When giving a diagnosis, you're basically now determining what's going to happen with that particular patient from that point forward. Pathology is probably one of the most visually intensive fields. Let me see a picture of it, let me look at it. The nice thing about having a easy-to-share Webex type platform, my microscope here is hooked up to the computer. I have a video camera on it, so I just share the desktop and can actually drive the slide that they have sent me and talk about exactly what it is I'm seeing. It was really accepted as a great way of understanding it, getting an education, and in real time talking about the case. I had a case that was sent to me from Greece. I ended up calling the daughter. She had actually said, what is the expected life expectancy and what should we do with management? I actually stopped and I said, what is it that you as a family have always wanted to do together? And she said, I know this sounds crazy, but we all had wanted to go to Hawaii. My answer to you in the management for your dad is all go to Hawaii and do it now. So one of the things that Webex certainly allows you to do with the video component of it, especially, you can look at them and know what your impact of the words that you're saying at that point are having on them. You get the sense of, you're in an exam room or in their home or in a setting that you can speak with them directly and know exactly what they're feeling.